Hello and welcome to the 2019 Open Enrollment Legislator Presentation. My name is Melanie Denning, and we appreciate you taking the time to attend today. If you were involved in the webcast, there were specific instructions about how to attend that presentation. Since this is a pre-recorded presentation, this slide does not apply. As a legislator, you should have received a postcard detailing the dates and times of the live open enrollment webcasts and how to access a recorded presentation. 2 legislator webcasts were to be held on the first Friday, October 12th at 1 p.m. and the second on Monday, October 15th at 10 a.m. As an alternative to listening to the live webcasts, a legislator may view a recorded presentation on the HCBD website after October 15th. The legislator open enrollment booklets will be mailed the week of October 15th, and the open enrollment booklet is also available on the HCBD website at www.benefits.mt.gov/open enrollment. Open enrollment will be held this year between October 28th and November 10th. Legislators who wish to make changes to their state plan benefits, which would include re-enrolling on the Vision hardware plan, must complete the open enrollment election by November 10th and will do so online this year. Legislators will not receive paper election forms this year and will instead be directed to complete open enrollment elections online. Legislators will have the ability to request a paper enrollment form by contacting HCBD. More information will be provided in the next few slides. Remember, the State of Montana Benefit Plan, or state plan, is self-funded. The state plan is funded by monthly employee, legislator, and retiree contributions. The contributions are held by the state plan and used to pay state plan expenses, the vast majority of which are claims. In 2016, transparent pricing, also known as reference-based pricing, was implemented and allowed us to control the cost of health care while maintaining quality, predictability, and fairness. We called this new way of reimbursing providers transparent pricing, but it really was the introduction of what many in the healthcare industry call value-based care. In 2017, we saw medical trend, or expenses, decrease, coming in at $130 million compared to $137 million in 2016. In 2017, Navitas became the State of Montana State Plan Pharmacy Benefit Manager. Navitas allows for a full pass-through of transparent pricing model that ensures that the state plan receives all rebates and reimburses pharmacies the exact amount paid by the state plan. In 2017, we saw prescription trend, or expense, decrease, coming in at $25 million compared to $32 million in 2016. Dental-related expenses remain stable at $8 million. And when you balance our income with our expenses, you get the state's plan reserve. As noted, on the state plan reserves are needed because we can't control all of the variables surrounding operating the state plan. We are able to control many of our plan costs, but there are some things we don't have direct control over, including our largest income source, the employer contribution. The employer contribution is set by the legislature every 2 years, and HCBD provides funding recommendations, but ultimately has to comply with the funding set by legislature. The employer contribution has not changed in 2 years and will not change in 2019. Federal mandates also directly impact state plan expenses. For example, last year the state plan was required to cover statins, which are cholesterol-lowering medications, at a $0 copay due to the Affordable Care Act, or ACA. HCBD works hard to estimate and evaluate expenses so that we have a general idea of the volume of claims in a given year. But there can be surprises. Medical trend, the increasing cost of medical care, is a huge variable that the state plan has little control over, and it can be difficult to predict. The cost of medical procedures and prescription medications continues to rise year after year. For example, year to date, the state plan has seen a dramatic increase in the number of large claims, as well as the dollar amount associated with large claims. This year alone, we have one claim over $2 million and 3 others over $1 million. The state plan needs to always have enough money in the reserves to cover all 30,000 plus members when they need us. As noted in the previous slide, HCBD is progressive and working hard to develop and implement cost-saving strategies to keep employer, employee, legislator, and retiree contributions stable. The combination of all the cost-saving actions, which is transparent pricing, the Navitas PBM, the new Medication Therapy Management or MTM program, increased efficiencies at the Montana Health Centers, etc., has allowed HCBD to minimize the financial impacts to all state plan members over the last few years. While progress has been made and money has been saved, now that we are more than 2 years into transparent pricing agreements with hospitals, HCBD believes there is an opportunity to do even more to control costs. We will be asking our hospital partners to look even more closely at pricing, and we ask that state plan members look at any care they might have outside of the state, and if appropriate, consider keeping it within our in-state partners. HCBD will continue its efforts to control costs and manage the state plan, continuing to work with Montana hospitals and other partners to address the rising cost of health care on behalf of all state plan members and the state of Montana taxpayers. Employer, employee, and legislator contributions will remain the same for 2019. HCBD is pleased to make this announcement and would like to highlight that this is the 3rd year that the state plan has been able to pass on a $0 increase to the state of Montana, its employees, and legislators. This slide reflects the medical, dental, and vision hardware contributions for 2019. Again, there is no change for the contributions in 2019. This slide reflects the legislator life insurance rates. Again, no change. In addition to no rate increase, we are pleased to announce that there will be no change to the medical plan out-of-pocket costs. This means that medical plan copays, deductibles, and maximum out-of-pocket costs will stay the same for 2019, and you can refer to the open enrollment booklet, the HCBD website, or the WRAP plan document for additional state plan coverage information. Please remember, state plan members, including dependents, cannot use the state plan, including the Montana Health Center, for any work-related illness or injury. If you or anyone covered on the state plan, including dependents, gets hurt or sick while working, the state plan will not provide coverage, even if you have a work comp waiver. HCBD has seen an increase in appeals regarding work-related injuries due to no state plan coverage. So please make sure you have the proper insurance coverage in place to cover work-related injuries. This year's Live Life Well incentive deadline is October 31st, 2018. Don't miss out. Hopefully, you've already completed a state-sponsored health screening, and we have sent many reminders. This year, you must complete all 3 requirements in order to earn any incentive. Once you complete a health screening, it will be automatically reported on the MyActiveHealth site. It takes about a month from the date of the screening to show up on the site. However, to earn your incentive, you must also self-report your nicotine status and your next step activity to the My Active Health site. Even if you did a wellness challenge like the Governor's Stay Active Challenge, you still need to self-report it in the My Active Health website in order to earn the incentive. If you are not nicotine-free, but did an alternative like a nicotine cessation program, you will have to self-report that as well. You should self-report your nicotine status and next step activity as soon as they're completed. You do not need to wait for your health screening activity to show. Additional instructions are also available at the benefits.mt.gov/incentive website. If you are ready to self-report, go to myactivehealth.com/SOM. If you have any questions about the Live Life Well Incentive Program, go to benefits.mt.gov/incentive. If there's a medical reason that you can't do any parts of the Live Life Well incentive, there are exceptions and alternatives available. Please call the Healthcare and Benefits Division to learn more, or email us at benefitsquestions@mt.gov. The Live Life Well program restarts on November 1st of 2018, and the 2019 Live Life Well incentive program will be exactly the same. Additional information has been included in the open enrollment booklet and on the HCBD website. This will be updated with the next year's program information after November 1st. Open enrollment. This year, open enrollment period runs from October 28th until November 10th. This year's all state plan members, employees, legislators, and retirees will complete open enrollment elections online or via a mobile device. The open enrollment booklet contains important information that you need to know about completing your benefit elections. The booklet will be mailed the week of October 15th, and open enrollment systems will be open for enrollment starting on October 28th. If you do not have internet access or would like to manually complete your open enrollment elections, please contact the Healthcare and Benefits Division. All open enrollment elections must be completed by November 10th, even if you elect to complete your election manually. During the open enrollment period, you can make changes to or waive the state plan coverage. You can also add or delete dependents from the plan. This is also the time to elect or re-elect the Vision Hardware Plan. The Vision Hardware Plan will be terminated effective January 1st, 2019 if you do not complete an open enrollment election. Again, if you do not complete open enrollment election, you will have the same medical, dental, and basic life coverage that you currently have, and if you do not complete open enrollment, you will not be enrolled in the Vision Hardware Plan, even if you had coverage in 2018. The open enrollment period is also a time you can elect to be joint core. If you and your spouse or domestic partner both work for the state, you are eligible for benefits and have a dependent child or children covered on the state plan, then you should be joint core. Being joint core means that you have one shared family maximum out of pocket, and the rate is better than being an employee and children plus employee only. For more information, contact Healthcare and Benefits Division. If you do not wish to make any changes to your current coverage or elect or re-elect the Vision Hardware Plan, you do not need to do anything during open enrollment period, and you do not need to complete anything online. However, please remember that if you do not complete the 2019 open enrollment election process, you will have the same medical, dental, and basic life coverage for yourself, your spouse, or domestic partner and/or dependents in 2019 as you elected in 2018. You will not be enrolled in the Vision Hardware Plan unless you complete an open enrollment election. So contact the Healthcare and Benefits Division at benefitsquestions@mt.gov or via phone at 1-800-287-8266. All open enrollment elections are due by November 10th. Big changes are coming. Healthcare and Benefits Division is implementing a new benefits enrollment and administration system, Business Solver. Business Solver will replace the paper enrollment process that is used for legislators in the years past. The Business Solver system will be used for the 2019 open enrollment by all state plan members, including our employees, legislators, and retirees. With the new Business Solver system, state plan members will also have the ability to complete open enrollment elections on their mobile device. Login instructions are included in the open enrollment booklet, and the link to the open enrollment system will appear on the HCBD website on October 28th. If you do not have internet access, you may request a paper form from HCBD. Business Solver will also be assisting the state plan with monthly billing and collections. While you are in session, your contributions will be withheld via payroll deduction. However, when the session ends, you will receive a monthly invoice from Business Solver, and payments will be sent directly to Business Solver. Please watch your mail for monthly billing starting in May 2019, because it will look different. Also be aware that all state plan contributions must be current and paid in full by December 31st, 2018. Contact Healthcare and Benefits Division if you have any questions. Starting January 1st, 2019, you will be able to use the Business Solver system for all state plan enrollment needs. For example, legislators will use the Business Solver system to complete their initial enrollments, mid-year enrollment changes, request a termination, or update beneficiaries. The new Business Solver system is user-friendly and easily accessible. To access the new system after October 28th, simply go to benefits.mt.gov and click on the Open Enroll MT picture. Once you click on the Open Enrollment MT picture, you will be prompted to register. Since you will be a first-time user, please click on Register. Once you click Register, you will be prompted to set up your username, password, and security questions. The state plan's, quote, company key, unquote, is State of Montana, no spaces, lowercase, and will already be filled in because it is case sensitive. When you complete your registration, you will be asked to consent to electronic signatures. This will only happen the first time that you register in the system. After that, you will click Continue and be transferred to the home page that will be available to you each time that you access the system. Once you are transferred to the home page, click on Start Here. Follow the instructions to complete your open enrollment elections. You must complete your open enrollment elections by November 10th, and the system will show time that you have remaining to complete your enrollment. Once you begin the open enrollment process, you will be prompted to review the personal information on file. If any of the information on this page needs to be updated with the exception of marital status, you should contact Legislative Services Division and they will assist you in getting the information updated. SABRS is the system of record for your personal information and is the system which feeds the Business Solver information. However, before you are able to click Next, you will need to provide your marital status. The next section is for dependent information, allows you to make dependent information changes and to add or delete dependents. If a dependent is listed on the dependent information page, the member will be able to enroll that dependent on state plan coverage on the enrollment tabs that follow. When you click through each benefits section, electing or waiving coverage and selecting dependents to be enrolled, This screenshot is an example of an active employee's available benefit options. Yours as a legislator will be limited based on the benefits that you are eligible for as a legislator. Once all elections have been made, you will be prompted to confirm your elections and agree to the required contributions. If any additional action steps are required, based on the elections that you have made, such as dependent verification or evidence of insurability, then you will be prompted to complete the action required. If you are unable to complete the action at that time, you can click Next, and the system will remind you at a later date that there is an outstanding action required in order to complete the enrollment election. Once complete, you will be taken to the confirmation page and can print a copy of your elections by clicking on the Print Benefit Summary button in the top right corner of the screen. The Message Center will house a copy of the confirmation notice. The Message Center will also be used to provide you with other important state plan communications, such as reminders about dependent verification and evidence of insurability. You will receive a postcard when your 2019 benefit summary has been finalized. However, you can access this summary at any time by logging into the Business Solver system and clicking on the Benefits Summary button. Watch for the postcard and go online to verify that you have enrolled correctly for 2019. If a legislator opts out or waives state plan coverage, the legislator is eligible to receive reimbursement up to $1,054 per month for the premiums paid by the legislator in conjunction with an employer group health plan, or for premiums paid for certain types of disability life insurance. The state plan is restricted by federal regulation from providing reimbursement for Medicare, Medicare Supplement, Medicare Advantage, or individual coverage through an insurance carrier or the health insurance marketplace premium. To opt out or waive state plan coverage and receive the option 2 reimbursement, please complete the legislator opt-out waiver form found at www.benefits.mt.gov/forms. The reimbursement of any kind is not available if the legislator has enrolled on the state plan. During and after open enrollment, other important documents will be coming to you from HCBD, including the 2019 WRAP Plan Document, or WPD, which outlines everything that's covered and the state plan's details. You will also receive a summary of benefit coverage. This is the legal document required by the Affordable Health Care Act and is a short summary of our plan. You will receive a Medicare Part D creditable coverage letter and a few other legal notices. The Department of Justice and Motor Vehicle Division has asked Healthcare and Benefits to help in providing updates on Real ID. The Motor Vehicle Division will begin issuing Real IDs in January of 2019 and will allow individuals to schedule appointments to apply for a Real ID. Your current unexpired license or ID will continue to allow you to fly domestically or to access a federal facility until October of 2020. Refer to the Real ID website for additional information. www.mtrealid.gov is the website where you will find the latest information on where Montana is in the reference to the Real ID project. You will find an FAQ that shows the advantages of obtaining a Real ID and the locations that offering Real IDs will start in January of 2019, as well as cost. If you're looking for more information on your benefits, please feel free to contact the Healthcare and Benefits Division staff with any questions or concerns at 800-287-8266 or email us at benefitsquestions@mt.gov. Thank you.